There was quite a drastic national increase in obesity during the pandemic.
Dr. Andrea Mucci treats patients with diabetes at Cleveland Clinic Children's.
With that shift in obesity, we've noticed a big shift in diabetes. And related to the pandemic, there were increases in type 1 and type 2 diabetes being diagnosed in pediatrics, a much, much larger increase in type 2 diabetes. When people say diabetes, they usually mean diabetes mellitus, which is when the amount of sugar in the blood is too high. There's type 1, which is what classically used to be associated with childhood. It's an autoimmune type, and there's a lot of genetic risk in that. Type 2 diabetes, which previously, decades ago, used to be associated with people of older age, also a strong genetic drive, but with a strong lifestyle component. And then sometimes you can get diabetes from medications or other medical conditions.
Symptoms of diabetes can include urinating a lot, especially at night, increased thirst, weight loss, blurry vision, and fatigue. But some people don't notice any symptoms at all.
The core treatment for anyone with type 1 diabetes has always been insulin.
Insulin can be given by injection or through insulin pumps.
In other types of diabetes, such as type 2 diabetes, you don't always need insulin. You can sometimes use what we call oral medications, or medications you take by mouth. And the classic medication that most people have heard of before is metformin, but there's increasing types of medications that have been used in adults for a long time that we're now starting to get approved to use in children. There's now also the injectable medications that aren't insulin that can help manage both type 2 diabetes and weight. It's very frustrating that there are these medications. They're FDA approved and known to be safe. They're recommended by experts in the field, in the guidelines, and yet we're unable to use them as routinely as they would provide benefit. I think that with time, when we're able to appropriately implement the guidelines and the medications available due to insurance coverage and other barriers that are preventing our use of them routinely, I do think it will help, but I also think there's a lot that we as a society also need to do. There's a lot of differences in socioeconomic groups, all the social determinants that we talk about often, about access to fruits and vegetables, and our screen-focused culture. So I think that we still have a lot of challenges moving forward.
For Fox 8, I'm Dr. Mark.
Dr. Mark is sponsored by the Cleveland Clinic.